Good afternoon. Welcome. So my name is Ernest Smith. I'm president of the School of Medicine and Dentistry Alumni Council, and I'm honored to be here. I'd like to thank all of you for joining us today, and welcome back to the School of Medicine and Dentistry for those of you who are alumni. Whether you're here as an alum, faculty, staff, student, guest, we appreciate you being here in support of our reunion Meliora weekend and get a peek into the experiences that you had in the past years and hear today about looking forward to the future. It's my great honor to introduce you to Dr. David C. Linehan, CEO of the University of Rochester Medical Center, Dean of the School of Medicine and Dentistry, and Senior Vice President of Health Sciences at the University of Rochester. He previously chaired URMC's Department of Surgery for 10 years. He's a surgical oncologist and accomplished researcher with over 150 peer-reviewed published papers. Dr. Linehan is recognized for bringing new therapies to patients with difficult-to-treat cancers and for his compassionate approach to care. He is internationally renowned for his research into new immunotherapy treatments for pancreatic cancer, and his laboratory has been continuously funded by the National Cancer Institute for over 20 years. He specializes in treating cancers and benign surgical conditions of the liver, pancreas, gallbladder, and bile ducts. Dr. Linehan graduated from Dartmouth College and University of Massachusetts Medical School, then completed his internship and residency at Deaconess Harvard Surgical Service. He was a research fellow at Brigham and Women's Hospital and the Kirsten Ann Carr Fellow in Surgical Oncology at Memorial Sloan Kettering Cancer Center. He went on to become professor of surgery at Washington University and chief of hepatobiliary, pancreatic, and gastrointestinal surgery. So please welcome me in joining Dr. Linehan, Dean and CEO, who will be giving his address through Zoom.
Thank you, Ernest, and thanks to all the members of the Alumni Council for all the effort you put in staying connected to SMD. I really appreciate it. I apologize that I can't be with you in person. I've had a very ill-timed battle with the COVID virus, and it started over the weekend, and I had a couple of rough days, but I'm actually feeling a lot better. I'm just still on quarantine, and I did not want to turn Meliora weekend into a super spreader event. So unfortunately, I have to be with you all by Zoom, and I'm sorry about that because I really had a great time last year just interacting with all the alums that came back. It was a fantastic weekend. So I hope that you're enjoying all the festivities. So I want to welcome you all to Meliora weekend with a special welcome to our 25th and 50th class reunions. It's so nice to see all of you coming back to Rochester, and it's gratifying for me as dean that so many alums from the class of 2000 and the class of 1975 and even earlier graduation years are joining for our centennial celebration. That's why I asked for your names to be listed on this slide. I believe Lowell Whitecamp from the class of 1962 is our earliest graduate in attendance. So do the math. That means that Dr. Whitecamp is here for his 63rd reunion. And Dr. Whitecamp, I wish I could be there in person to thank you and your classmates for endowing the auditorium that you are meeting in today, the class of 62 auditorium. So I appreciate today's opportunity to share my vision and goals for the future of our medical center. While I've been here in Rochester, as Ernest pointed out, over a decade, I've been in the role of CEO and dean for about 15 months now. Great timing, huh? Start with a grand vision and a dream, just as the government is disinvesting $1 trillion from healthcare. But all kidding aside, I'm delighted to be the leader of this amazing and growing academic medical center. While I love being chair of surgery here, it's energizing to navigate our institution through challenging times. I enjoy solving complex problems, and we have plenty of those, as I'm sure you know. Our strategy for addressing current challenges is to sharpen our focus on communicating the enduring value of a research-driven academic medical center powered by dedicated and innovative people. It's the quality of all the mission-driven people who work here at URMC and our affiliates that make me glad to come to work every day. So rather than get bogged down by the daily distractions like the executive order du jour, I've been thinking about the bigger picture and how we can create a bold future together. That's what I want to discuss with you today, how we use our fundamental strengths to propel our academic medical center forward. During my first 6 months in this role, I conducted a structured listening tour. As the internal candidate with a decade of service, I thought I knew everything about URMC, but I've learned so much by taking time to listen. Over time, I've had the privilege of interacting with hundreds of teams and individuals across this institution, and I continue to be impressed and inspired by the caliber of people working here and their dedication to our missions. When I ask people why they chose to work for the medical center in our health system, the answer is almost always the same. Our collective why is advancing research, education, and patient care to help patients live their best and healthiest lives. And collectively, we've achieved a lot. In the last decade, we have grown as a comprehensive regional health system from 2 hospitals in Monroe County to 8 hospitals serving communities across the Finger Lakes, the Southern Tier, and Western New York. Our system provides the region a full continuum of services, including primary care, home care, long-term care, in addition to advanced specialty care in our hospitals and outpatient clinics. Our research teams are making discoveries that advance scientific understanding of disease and leading clinical trials with outcomes that improve standards of care and help inform health policy. Our schools and graduate education programs are highly ranked nationally. They attract top-notch learners who represent the next generation of health professionals and scientists. But these accomplishments haven't been easy. Past leaders here faced many uncertain times throughout our history, including world wars, epidemics, and global economic downturns. Yet here we are, bigger and better than ever. Over the past 3 years, we have had to focus intensely on restoring financial stability in the post-COVID era. More recently, changes in federal funding priorities require us to reimagine how we adjust our work to sustain our missions. Despite this uncertainty, I believe we must have a forward-looking plan for our future and prepare to come out stronger than before. And we will survive today's challenges, just as we survived the COVID pandemic, the 2008 financial crisis, and numerous other obstacles in the past. To explain my confidence, I'd like to briefly reflect on how we got here. In 1922, the land where our campus stands today was an empty field on the Crittenden family farm. That's the photo that you see on the left. But University of Rochester President Rush Reese had a vision to transform this land into a teaching hospital. He solicited financial support from George Eastman and his Kodak business partner, Henry Alva Strong. Their ideas were ambitious: give Rochester residents access to the best possible medical treatments, train health professionals to provide exceptional evidence-based patient care, and conduct groundbreaking research to advance medical knowledge. Over the last 100 years, that vision has become a reality. We've grown into a top-notch academic health system with more than 30,000 employees overall, including 3,000 faculty and staff members engaged every day in biomedical research. We have nationally prominent schools of medicine and nursing with a globally recognized Institute for Oral Health. One thing that distinguishes an AMC from other health systems is that we improve the health of people not just in our local area, but everywhere. Sure, we strive to provide expert and empathetic care to every patient who walks through our doors. We are firmly committed to the health and well-being of the communities that we serve, but that by itself isn't enough. Our research and training missions extend the impact of our work far beyond Rochester, Monroe County, the Finger Lakes, or the Southern Tier. That's why I believe at my core that URMC's ability to lead innovations in healthcare delivery and biomedical research will survive and even thrive if we have a plan and we all work together. So as we celebrate our medical center's centennial, let's consider where we will be in the next 100 years. What's our vision for advancing clinical care, research, education, and community service? What will the academic medical center of the future look like, and what can we do to lead the way? How can we strengthen our ability to serve our patients and help people around the world to live better and healthier lives? With those questions in mind, I asked our team to put together a video to help articulate my optimistic vision for our future. So let's just take a look.
Extraordinary things happen here. This isn't just a medical center. Thanks to your efforts, we're a beacon of hope where miracles unfold. Everyone who passes through our doors puts their trust in us. Each of us plays a part in honoring that trust. We know our work has challenges. To meet them better, we need a shared vision anchored by our core values of supporting each other and our diverse community. We're one team with one purpose: helping each other and our patients do better, feel better, live better. As an academic health system, it's not enough to provide care. We need to continuously improve care through research and innovation. Our vision is to create a culture where everyone wants to work and learn. We succeed by focusing on well-being, alleviating workforce shortages, and expanding innovative learning models across all schools. Our vision is to be known nationally for innovation. We succeed through team-based science, transdisciplinary care teams, in turning research into cures faster, all with an unrelenting focus on our patients. Our vision is health equity and better access to care for all. We succeed by growing programs, community engagement and diversity, and embracing digital tools and AI to improve care. Our vision is to bring our expertise to everyone in the region and beyond, leading in specialized care, but also the preventative care that supports members of our communities in living their healthiest lives possible. We succeed when we all find ways to work smarter so we thrive in all of our missions. But we need everyone's help, your help, because whether you're cleaning rooms or finding cures, beautifying our facility or studying for board exams, we are all caregivers. We all contribute to the team. So share your ideas, challenge outdated thinking, support one another. And I'll commit to lead by example, advocate for you, and celebrate your work. Our vision is one team, one purpose, helping each other be ever better for the people who entrust us with their lives.
So let me explain to you why I am so optimistic about our future. As you may know, I received my training at top-ranked institutions in the Northeast, then spent 15 years on the faculty of a major academic medical center in the Midwest. And yet I chose the University of Rochester to advance my career. During my tenure here, I observed that our culture is humble, almost to a fault. Many people here take for granted URMC's enormous achievements in medicine, nursing, and dentistry. Having spent much of my career at other top-ranked institutions, I can tell you we rank with the best of them. From university trustees to faculty to staff members to alumni to supporters, people can and should feel very proud to be part of our team. Think about this. The University of Rochester created the biopsychosocial model that revolutionized medical education and patient care over 50 years ago. When I came here in 2014, top leaders at 7 of the nation's most highly regarded academic medical centers had been trained or started their careers here. We train academic leaders at the University of Rochester. And although we are celebrating the School of Medicine today, let's not forget our dentistry and nursing schools. Larry Tabak, for example, an EIOH researcher, went on to lead the National Institute of Dental and Craniofacial Research and later became the acting director of the NIH. And Lee Ford, the founding dean of our nursing school, was widely celebrated as the mother of nurse practitioners. She used this campus to create the unification model that combines education, patient care, and nursing research. These accomplishments didn't happen by chance. They happened because this is a place where talented and collegial people with innovative ideas collaborate to advance human health. They happen because we have great clinicians, scientists, and mentors all working at the top of their profession. I'm sure many of you in this room recall working with and learning from some of the renowned faculty members pictured on this slide. From Birch Griggs and Barb Begluski to Art Moss and David Smith, some are among the giants of their respective fields of research. Others were known as outstanding educators and mentors, including Don Bordley, Jules Cohen, and Lissa McInerney. And some were outstanding leaders in all aspects of academic medicine, including Bob Joint and my personal mentor as a surgeon scientist, Cy Schwartz. I hope to hear memories from some of you about these and other faculty members who influenced your careers. To this day, as I walk around campus, I see what makes URMC special. Scientists engaged in impactful research from foundational discoveries to translational science to leading-edge clinical trials. Students receiving first-class clinical training from passionate faculty assisted by state-of-the-art technology. Patients receiving the most comprehensive primary and advanced specialty care anywhere in the world. And all of this happens on one connected university campus that makes it easy to collaborate with colleagues across multiple disciplines. But we don't need to rest on our past successes. We've had many recent achievements to make us proud. Last year, for example, Strong Memorial received its 5th consecutive designation as a nursing magnet hospital, one of few in the nation to have received that 5 times. And our medical school received 8 years of reaccreditation. Earlier this year, the School of Medicine and Dentistry was named a Tier 1 research medical school in U.S. News and World Report, and the School of Nursing placed 15th in the nation for its master's program. And in the latest Best Hospital listing, Strong Memorial is the highest ranked hospital in our state outside of the New York City metro area. We also continue to attract world-class faculty and leaders. Michael Scott, whose quality improvement work set new worldwide standards of care for surgery patients, joined us from the University of Pennsylvania to chair the Anesthesiology and Perioperative Medicine Department recently. And in the past few months, we welcomed Ryan Fields, who you heard at the Med Talks this morning, a highly accomplished surgical oncologist and translational scientist at Washington University, as our new chair of surgery. We also recruited Tanya Mayatis from a tenured professorship at Harvard to serve as the chair of immunology and microbiology and director of our new Institute for Immunological Sciences. This is a homecoming for Tanya, who received an undergraduate degree in biology from the university in 1983 and a PhD in biochemistry in 1989. Last June, we celebrated a $50 million gift from Tom Golisano, the largest in university history, which will enable us to build the Golisano Intellectual and Developmental Disabilities Institute. And last October, Emeritus Board Member Phil Saunders announced a $30 million gift to support our Ambulatory Orthopedics and Physical Performance Center, along with more nursing scholarships. Just a few months ago, we were in the Flaum atrium announcing a $10 million cancer support grant, making Wilmot the 73rd center in the nation to be designated by the National Cancer Institute. And over the summer in July, Vera Gorbanova and her team received a Nathan Schock Award, making Rochester one of 8 centers of excellence in aging research recognized by the NIH. These achievements and investments are a credit to the incredibly talented faculty and staff of URMC, as well as the leadership and support of trustees, board members, and generous donors. So where will we be 10 years from now? I envision a thriving, internationally renowned academic medical center, a health system that's a national model for patient care and equitable outcomes, a place where faculty, staff, and learners work as one team united by one purpose that has guided us for a century, really, becoming ever better at caring for people who entrust us with their lives while also caring for one another. My belief in this vision is supported by 4 pillars grounded in foundational strengths that have made us great in the past and will make us even greater in the future. Working together as one team with one purpose, we will make URMC and all our affiliate organizations the best place to innovate, the best place to work, the best place to learn, and the best place to heal for everyone we serve. So let's start with being the best place to innovate. Face it, innovation is the reason academic medical centers exist, the why that brings many of us to work every day. Our faculty and staff don't just care for patients, we advance human health and alleviate suffering through teaching and research. So to become the best at innovation, we will grow foundational programs of scientific strength and impact while investing in the core services we need to support success. We'll expand team science across divisions, departments, and schools where we can be the most consequential. We will become a clinical trials powerhouse by streamlining processes and removing bench-to-bedside barriers. And we'll invest in the infrastructure we need to foster impactful science and high-functioning clinical service lines. Now let's talk about how we make URMC the best place to work. We already have an impressive track record of attracting high-caliber people who choose to work here, but we can do more. To achieve our vision, we will create an inclusive culture where people are eager to work and grow. Specific goals are to reimagine the eye care values with a focus on workforce well-being, to modernize our facilities and leverage technology to support workplace satisfaction, to strengthen pipeline programs in workforce shortage areas, to celebrate team successes while showing every employee that we appreciate the value of their work, and provide well-defined opportunities for all to advance their careers here. Educating the workforce of the future is a third pillar supporting our vision. As an academic medical center, it's our job to prepare health professionals and clinical support staff for rapidly changing technology and care delivery models. The health system of the future will be different, and the challenge will be to embrace new technology while maintaining the human touch. We need energized faculty who engage learners to become caregivers and scientists prepared to discover ever better cures. To be the best place to learn, we will create an environment where learning to translate science to clinical care happens naturally. We'll expand dual degree options and team-based learning. We'll add training programs for high-need clinical support roles through pipeline programs, partnerships with our community, and new schools as needed. And we'll leverage new technologies, including generative AI, for precision education and improved learning. Becoming the best place to heal recognizes our need to continuously improve the quality and safety of patient care, helping people live their best and healthiest lives. To achieve our vision, it's critical to function as a fully integrated health system with seamless transitions of care, consistent quality, equitable outcomes, and high patient satisfaction. We'll implement consumer-focused and value-based care models with a stronger focus on access, preventive care, long-term care, and patient education to reduce preventable diseases. As part of our focus on access, we must reduce wait times, providing service close to home or even in the home, and restore capacity to provide complex care to those who need it. Finally, we will leverage technology to enhance patient, provider, and staff experience. If we commit to these goals, I'm confident that we will become an ever better, more prominent academic medical center. We will attract top talent and be the health system of choice for patients, payers, employers, and funding agencies. Changes in government priorities require us to be flexible, and we need to plan for that. But the nation and the world need academic medical centers. Patients need our care, the country needs the providers we train, and the world needs our impactful research from bench to bedside that improves human lives. Given the level of talent we attract, a size that makes us nimble, and a university campus that fosters collaboration, we're well equipped to survive and thrive in our next century. Because everyone plays a role in making our vision happen, I've shared this presentation with my leadership team across the institution, and we've provided communication tools to help them share it with their teams and to bring forward strategical, tactical, and management plans that align with these priorities. Years ago, when I was giving a lecture at Emory University, I noticed this quote on the wall of the lecture hall. It said, "The future always belongs to the discontented." That was the motto of Robert Woodruff, who became the CEO of Coca-Cola in 1923. Of course, it's key to understand that there's a difference between discontent and malcontent. The discontented person has a positive outlook, yet always wonders whether we can think of ways to make things better. The malcontent is the naysayer in the room. We all know this person. It's that person who's never happy, always sees the glass as half empty. They're always looking for reasons to tell you that a new idea won't work. Woodruff used the positive side of discontent to propel Coke, which at the time was a locally produced soda of uneven quality, into one of the world's most popular and widely recognized brands. As I returned from that talk at Emory, it struck me that the University of Rochester motto is the same. We just say it a lot more simply, Meliora. A restless rejection of the status quo, an inkling that something you saw today could be done better, a challenge to wonder how we can continuously strive to improve patient outcomes and help people live healthier lives. In that way, Meliora, in a single word, captures the essence and purpose of an academic medical center. So before answering questions and listening to your memories, I want to describe the special role our alumni can play in supporting our vision. To achieve these ambitious goals, I'm inviting you, along with your grateful patients in the community, to imagine the impact your support can make as we launch the Forever Better campaign. My vision is based on making URMC and our health system the best place to innovate, work, learn, and heal. The campaign supports this vision with 4 pillars that will enable us to fund the development of new ideas, provide scholarships to more learners, transform our clinical and academic spaces, and expand support for the health and well-being of our communities. We need your help to raise awareness about the campaign and all that we hope to accomplish together. Just being here for Meliora Weekend is a wonderful start. Please keep your Rochester connections strong, attend alumni events near where you live, share a class note in our alumni magazine, or reach out to classmates. Consider a volunteer role by serving on a council, committee, or advisory board to extend your talent and share your insights. Or make a gift that invests in the future of our patients, clinicians, scientists, and students, shaping the lasting impact you wish to have. And as we celebrate the centennial anniversary of the School of Medicine and Dentistry, we invite you to help define the next 100 years as we invest in the future of the University of Rochester Medical Center. Now, I'd welcome hearing from you some memories about your time at this wonderful school and discussing how we can make it ever better. Thank you so much for your attention.
Thank you for a lovely presentation, sir. Larry Morris, class of '85, medical school. Very optimistic, and I appreciate your optimism. So what keeps you up at night these days?
Well, I think the issue is around the financial sustainability, but we've been dealing with that since the post-COVID era, trying to figure out ways to improve the financial sustainability, looking at ways to be able to continue to do all the things that we do with the resources, which seem to have been limited. We've made great strides, actually. If you look at our health system as it's grown, we're up to 8 hospitals now, 6 of which are rural hospitals. And all 6 of our rural hospitals are actually breaking even or making money, which I don't think that there's any other health systems in the country that can say that about all of their rural hospitals. So we've spent a lot of time trying to figure out how to increase revenue and decrease expense so that we have the margin to be able to do all these wonderful things that I'm talking about in terms of education and research. And we've had good success. So we're pretty strong going into this right now. And we've grown, I think, in a way that gives us more of a cushion, I think, as we deal with the changes that are coming. The things that kind of keep me up at night is what's happening with what happened in the reconciliation bill with making more and more people fall off the Medicaid rolls. And so we're working with our state legislators, our community partners, the other health system to try to mitigate those issues. coming up with some creative ways of trying to help people stay covered. And then as we've grown with 8 rural hospitals. We've also grown our accountable care organization, which is now up to about 800,000 covered lives. So we can start to look at areas where we can take on capitated risk and alternative payment models, try to really bend the cost curve, still provide the highest quality, highest safety care at lower cost. And so we're working hard on trying to figure out some alternative payment models that will help sustain us as the traditional ways that we've gotten paid are changing. What's really been keeping me up is this COVID cough, but that's getting better.
Thank you for this great presentation. I'm wondering, because one of the risks that we all face in research is the threat of cutting indirect costs. I'm wondering, when you're out in the community, how do you go about educating community members about what indirect costs are and why it's so critical that those cuts don't hit?
Yeah, that's a really important point, and I think we do a terrible job at that. And even, and not just with the community, even with our legislators, even our federal government legislators. I have met with a lot of our Congress people because we have really 3 where we have hospitals in Rochester on the east side and the west side, and even with the federal legislators, their understanding of what F&A was surprising. Shall we say. And I think the best way to simplify it so that people can understand it, for every dollar that we spend on research at the institution, half of it comes from grants, most from the federal government, but the other half comes from us. It comes from endowment, it comes from gifts, it comes from foundations, it comes from the university, the transfer of clinical margin to support research. So grants plus F&A don't come close to covering the cost of research. And I think that's just a very simple way to describe it to people.
Hello, David. This is Tanya here.
Oh, hi, Tanya.
Hi. Just wanted to sort of say, I mean, the reason I came home to Rochester after being in Boston is that very thing that you just said, this sort of hopeful outlook, the commitment to research and forward-looking, where many other institutions, including in Boston, are sort of pulling back and are not financially very well set for the next few years. And I feel like here we have, it's endless opportunities just because of the kind of people that are here and the collaborative spirit that makes Rochester so special. Thank you.
Thanks for saying that, Tanya. I'm glad to hear you came from Boston, not just because of the traffic. I think one of the things I'll add to that too, though, is I think it's a buyer's market for talent right now, because a lot of places are on lockdown. A lot of places are, I don't know, just projecting fear about the whole situation. I think at the end of the day, it's going to be difficult, but we'll get through it. And so I don't think it's the right approach to just kind of lock up and lose your optimism.
So good afternoon. Hi, I'm Chris Bever, class of 75. And like you, I've looked at what's been going on in the current administration I think. And I think many are, again, trying to focus on what you can do to deal with some of the negatives. And I appreciate the strategy that you've outlined. It did make me think whether there's anything in the current administration policy which are there things that you've identified that might be positive, somewhere that Rochester could do something different, change your strategy a little bit to try to align, at least in some ways, with the things that have been outlined. Thank you.
Yeah, Chris, that's a really good question. And I guess the first thing that comes to mind, I don't agree with Robert F. Kennedy on much, but I actually do think he's right about, coming up with more creative ways to prevent preventable disease and chronic disease. And so I do think that there's more that we can do to keep people healthy. And I think we're really, really good at getting sick people through really difficult times. And I think we're less good at at robust prevention strategies and having interventions that help people before they get sick. And so I do think that is an approach. And I think as we get into more and more capitated care, obviously that becomes a more of a priority that it has been in a fee-for-service world. And so I think there's a lot more we can do. And we were just talking about this the other day in President Mengelsdorf's leadership meeting, because we are, of our 30,000 employees and their families, we're self-insured. So we see these costs that are coming through with marked increased pharma costs, with just the aging demographic of the baby boom. The cost of healthcare just continues to skyrocket. And so one of the things as a result of that is that our cost of providing care for our self-insured people has gone up pretty dramatically. And what that typically means is that when it comes time for renewing insurance, the premiums for our own employees go up. And so we don't really like doing that, obviously. And the question but it's obviously the commercial payers are doing that. Everyone's premiums are going up because if you look at how costs have gone up. But the question is can you, instead of hitting our employees with that stick, and we bring a carrot to the table and say, hey, let's focus and let's have more programs that we can have as an institution that are actually going to make you healthier, and really focus on the interventions that can prevent disease. So I do think that that's one positive thing that will come out of this. People have talked about, is there going to be less regulation, and I'm not sure that that's going to be a big bonus. And New York State specifically is healthcare is very, very heavily regulated, and there's good things about that and bad things about that. There's going to be, I think that when you take $1 trillion out of healthcare, there's going to have to be a push to try to bend the cost curve in healthcare. And, we pay twice as much as most developed countries for no better outcomes. So there's definitely a cost curve to be bent. And so I think we will see that accelerated over the next few years.
John Bowman, class of 1975. When I was here as a medical student 50 years ago, there was a lot of concern about providing primary care out in the rural areas like Cohocton and places in the southern tier. And now I hear that you have 8 hospitals, many of them in rural areas. What is the University of Rochester doing to maintain an excellent primary care network and solve the problem of over-specialization from the medical school classes that are graduating now?
Yeah, that's a really important point, John. And a big part of that started several years ago when we started the primary care network, and the primary care network continues to grow, up over, I think, 300 and something primary care providers at this point. And then we also partnered with the non-employed through AHP, through our accountable care organization. And we partnered with the non-affiliated primary care docs to build that primary care base up, which you need to be able to do this. And so it's come to the point where AHP is, I think, 85% PCPs employed by either the faculty practice or our rural hospitals, and there's very few private groups left, as you're probably well aware. But that kind of partnership, so we had enough primary care, we grew the covered lives that we had so that we can actually manage them better. So that Steve Judge is the head of the primary care network. He's done a remarkable job. We have more and more practices actually asking to join the university all the time. And you can't, I think the old way of thinking of things is we were up in the ivory tower, we only do tertiary and quaternary care, and we don't have to worry about the primary care. And that was an absolute fallacy. Fortunately, people here figured that out a long time ago and started building the primary care network.
Hi, Peter Rubin here from class of 70. Thank you for the pep talk, which we needed. I wanted to ask you, looking at the present and future, what's Rochester doing about AI in terms of teaching, in terms of education, and patient care?
Yeah, I think that's a huge opportunity for us. And obviously, generative AI is going to absolutely transform healthcare in the next 10 years. We're just going to see more and more applications. So one of the things that we've started here several years ago is our health lab, which really focuses on technology, digital front door, and all the things that we were doing sort of before before generative AI came on the scene. But like a good example of when COVID happened 5 years ago, that team jumped on it immediately, and they developed an AI chatbot that allowed us to manage our entire workforce with all the questions that come related to when can I go back to work, and when should I be tested, when should I be vaccinated, and that was developed here. It was in the middle of a pandemic, so of course we open sourced it and shared it with the world. And interestingly, we found out like 3 years later, someone had stolen it off the open source and were selling it. You know, it started a company and was selling the thing that was started here. So we've got our policy with AI has really been we're an Epic-based shop, and all of our affiliate hospitals are Epic-based. And so if there's an Epic solution to something, we typically use it. If there's not an Epic solution, then we'll go out to startup companies and look for sort of best out there, and then we'll offer to work with them and sometimes negotiate a partnership with them, share some of our clinical expertise to try to help some of these startups get off the ground. We've worked with, we joined this Qualified Health, which is a AI alliance of several, not a huge number, but I think they're up to 8 or 10 partners now, where we can develop things within the institution, beta test in a small place, and then send it out to all of the other places to test it, and then potentially commercialize it or use it in a more widespread way. And then Kathy Hochul, the governor of New York, to her credit, has set up Empire AI. So the state is making a big investment with not only the development of AI tools, but the compute needed to, for all the increased energy we're going to need for AI. And, Kathy Hochul is on the record just a couple months ago saying that she's building nuclear power plants in New York, new ones, because she doesn't want the lack of power to be the thing that holds us back from being AI leaders. So we've got state support. We've got through Qualified Health, we've got a nice consortium that we work with through our health lab here. We have a team of, and it's a really phenomenal team. I don't know if any of you have been over to tour through the health lab, but we've done that on several Meliora weekends, brought people over there to look at this team, and they're from all different disciplines. They come with ideas. There's a support structure there to nurture them, and it's been quite successful. And then the other thing on the education side, I think we play to the strengths that we have as a university, because in the on the River Campus side, we've got world-class experts that have been doing quantum compute for a long time. We've got phenomenal optics and laser energetics people, and so one of the more recent things is we put forward this transdisciplinary grant for groups that had to, the only prerequisite of the grant is it had to be different groups that don't normally work together have to work together. And one of the ones that got funded was based on augmented reality and virtual reality through the Gurgen Institute of Data Science. And there's several medical applications there around education with augmented reality. So there's a lot going on at the institution, and I think being integrated and unified as one university gives us levels of expertise that you don't see at sort of freestanding academic medical centers that aren't literally across the street from a world-class research-intensive university.